124 new cases have been confirmed, raising the total number of coronavirus infections in the country to 2,240. 4 more people have succumbed, bringing the total fatalities to 78, while 39 patients have been discharged after recovering. Mombasa registered the highest number of cases at 40, with Nairobi confirming 38 cases. Busia has 26, and Elgeyo Marakwet is the latest county to report an infection with 1 case. In Nairobi, the cases are spread out in Kibra with 25, 5 in Dagoretti, 4 in Kamkunji, and 1 case each in Embakasi East and Langata. And as the number of infections continues to rise, the government is looking to ease the burden on an increasingly strained healthcare system. The government is putting together an interim plan for safe home care for COVID-19 patients and their contacts to decongest hospitals and prevent them from being overwhelmed. Eunice Omolo has more.
The strains of the coronavirus are starting to show, as isolation centers battle what could be an apocalyptic surge in the number of patients in need of treatment. As the number of infections soar, and with many more samples stuck in the testing labs of a shortage of testing kits.
Because we are reaching, for example, in Nairobi, at a time when both Bagathi and KU are already getting to full status.
The Ministry of Health is now preparing for a full-blown crisis and is considering patients with only mild symptoms from isolation centers to continue with home-based care as soon as the protocols are in place.
With the fight against the virus continuing, we have realized that over 80% of our patients in hospitals are asymptomatic, and therefore baby can and may be managed from home. If this is implemented, it would free our health facilities from congestion.
WHO recommends that for patients presenting mild illness, hospitalization may not be required unless there is concern about a rapid deterioration and they cannot recuperate under care provided at home.
Is that a lot of people who are in isolation facilities may be released to be taken care of at their homes, provided 2 things happen. A, it is in accordance with new World Health Organization protocols that we are still looking at and trying to customize and domesticate to our situation. Number 2, it has to do with the facilities that families may have, and where where families are not able to either self-quarantine or self-isolate, the government will still assist in the process.
Home-based care may also be considered when inpatient care is unavailable or, if available, resources are unable to meet the demands for healthcare services. Patients with mild symptoms and without underlying chronic conditions may be cared for at home. Other patients who may be cared for at home include those who are symptomatic but no longer require hospitalization, and in cases in which an informed decision has been made to refuse hospitalization. With the number of confirmed COVID-19 cases on the rise in Kenya, many of the affected people face stigma for carrying the disease. For this reason, avoiding a backlash in their community, many are picked up for treatment by medical teams far away from their homes, including on the sides of the road.
There is no need for stigmatization. It is not necessary. You will be safe, but the people concerned will have to take care, and the families, you have to take care of them so that they do not, because they do not need hospitalization.
The ministry says the protocols that the ministry is putting in place to facilitate home-based care will address the stigma associated with COVID-19 patients. Eunice Omolo, NTV, Nairobi.